Hi friends, I want to say something about surgeoncut.com. Lot of doctors, surgeons, dental surgeons, other medical professionals world over have been regularly asking us for videos that YouTube doesn't like to show to people because it has a lot of blood content and it's the way we do surgeries. So we've got this website now up and about. You can subscribe, you can learn how we do these surgeries exactly. No editing, but in good clarity, 4K clarity. So all the best and thank you. Okay. Smile. Okay, relax. Okay. All right. So your main concern is the thickness of the lip, right? We will reduce that. That's a plan that we've done for you, reduction. But also, because you've come for a facial consultation, I can tell you what are the procedures can make good improvements. Okay, one of the things is slight work on the chin because the chin is inside, and this is very strong and has come outside. So we need to take the angle part of you in, retaining the angle as in the shape, but the swelling or the protrusion, it has to be made more angular. And this can be nice, and the nose is very flat there. And it's broad here, so we need to work on this height, this width and this width, and then maybe little bit on the forehead also, so you get some hair down so that your forehead, that curved part is not visible, and then also it gets proportional, otherwise the forehead is overly too large. So these are things that you can consider in the future if you do decide or you do want to, but we can do the upper and lower lip reduction now. One more thing, quick thing about the reduction thing. You have any pictures or anything that you want to show me? Because I'm not a big fan of reducing it too much, because that's going to take your racial features off.
Definitely, I want
just a subtle one.
Just to be harmonious with my other features.
Correct.
And
done.
I mean, I can always go back in and take more off, but
that's not the idea. The idea is to just make sure it suits a little bit to the face.
Yeah.
All right. You want to show me anything or?
Like the way I would like it.
No,
I don't have anything.
Sure, no problems. So so we will just go. See, anyway, it's done under daycare or local anesthesia, which means you're going to be awake. So I'm going to numb this area first up, then I'll mark with a pen, I'll show it to you.
Yes, please.
And then what I think is enough. And then we'll go ahead and do it, and again we'll show it to you.
Okay.
So that you see what has been removed and you see how it's looking. And then if you're okay, we say done, or if you want some more changes, we still can do it there.
Okay. I have a question. Will I have a gummy smile?
Yes. Yes.
Is it going to be a lot?
It's not going to be a lot more because you already have a gummy smile. You will have.
Yeah.
You will have that.
Are you familiar with the bikini lip reduction?
Yes, but I don't think I recommend that for you.
Okay.
Because you know when you do that lip reduction, this will open up. Your vermilion is thick. This height is not long. As you age, the length of the lip, if it becomes long, then you can reduce the lip here.
Okay, yeah.
But your lip thickness is more, so you can't do that. It's going to look even more. Come here,
and
show you.
I don't even want to change my shape. So.
Yeah, so if you look here, see, if you reduce like that, you see that? It looks even bigger.
Yeah.
So what we need to do for you is just from here, so we take a wedge off. And this thickness we have to reduce.
Yeah.
If I reduce it there, it's going to look thicker.
Okay.
So when people are like in their 4th, 5th decade, when the elasticity of the skin goes down, when the lip gets long and droopy, then we do this. So the vermilion show increases. You already have a excess vermilion show, so that's not something you should do. The only thing that you could do ever is to just get this part tucked in, so it becomes like this.
And also
like this, you know?
Yeah.
And similarly here, this goes in a little bit. It basically goes inwards.
Also, I have a third lip. See?
Yeah, that's got the double lip.
You're gonna excise this as well.
I can just trim it, yeah.
Trim it. Yeah.
So when you smile a lot, yeah, it's not so much visible still.
Yeah, but
when you do that, it's visible.
It's thick here.
Correct. That's gonna get reduced from inside. Yeah, correct.
It's a lot going on.
So anyway, the work is going to be on the wet mucosa. Take your hands on one second, I'll show you. So this is the dry mucosa.
Yeah.
This is the junction between the wet and the dry. And all your work is going to be in the wet mucosa.
Yeah.
That's the wet mucosa. That's when the lip will go a little bit inwards as well. So yeah, we're gonna take.
Gonna be removed.
We're gonna take care of that. Sure. And with regards to the lower lip, we're just gonna reduce make it, proportional to the upper lip. All right.
So are you gonna cut from here?
From inside, yeah.
Right here, right?
The wet mucosa, whatever is light color, we're gonna cut from the inside.
How's the recovery?
So when you go back, see, one day here is enough, and I can review you after a few days, and that's it. The full recovery may be 7 to 10 days.
And will my filling from be more distant?
No.
To my nose?
No.
Okay.
It's going to be the same.
Okay.
That was a good question. Filtrum be more distant to the nose.
Because sometimes when I tuck it in, it looks longer. And I'd be like,
Yeah, no, we're not going to make the lip longer. We're just going to make the width less. You got me right?
yeah.
So shall we start off in about half an hour? You think that's okay?
Yeah.
2 point ko shift karo. And how long are you going to stay in our city?
Until Friday.
Until Friday.
Thursday.
So that's like almost a week, which is
Thursday.
good. So we do it today. You've got a hotel done, hotel
Yes.
booking done. Cool. So we finish everything. We keep you with us till maybe late evening.
Okay.
Once you're comfortable, not having any pain, and then we can shift you to the hotel. You can come back again after a few days.
Okay.
Definitely, you have to come back before you leave.
Okay.
We'll give you on some oral medications at that time.
Okay.
All right. You will have some dietary restrictions because when we do work on the lips and both the lips, it'll be a little numb, and you can't chew a lot of food because then you can chew on the stitch or something. And plus, I told you I'm going to do from inside on the wet mucosa. So some liquid food you will need at least for a day or two.
I'm prepared. I have
Sure.
all my liquid food, everything.
You've got all
I
your
got
food.
baby food, baby bride. I'm prepared.
Awesome. Nice to know. All right, Sinko for shift karo. Right, I'll see you in about half an hour.
Okay.
They will prepare you on top. Don't be scared. It's just going to be under local anesthesia, which means you'll feel the prick when we give the injection, and then you'll know that we're all around you, but you'll not feel the pain.
Okay.
So there will be lights on top and everything. So, just nothing to worry.
Question about the scar.
Uh-huh.
Can it get like hard?
No, it will not get hard. Initially, it will be hard, but it'll get soft and supple like your lip. Yeah, it's not going to be hard.
I'm just nervous about the results because at surgery, I think it's going to go good, but the results, I hope it's going to look good on my face. That's all I'm worried about a little bit.
It will look a little bit improved. It's not going to make a dramatic,
Difference?
total change.
Okay.
Because we're just altering a bit on the thickness or the size of the lips. When we consider, like I was saying about chin, angle,
Yeah.
that's like a face makeover.
Yeah.
Then I think you have to be a little bit more scared or concerned, because then we're going to change a lot, and you should be prepared to accept that change, even though that's for the benefit, for the betterment, or for the good. But in this case, there's nothing much, because we're looking at taking 3 or 4 millimeters off. So it's just going to be so subtle, people won't even notice.
Yeah.
So just chill on that.
Okay.
All right? ठीक है, इनको ऊपर लेके जाओ. Yeah.
I'm talking to God.
Talking to God.
Take over, Lord. Okay.
Don't worry. Take care. Okay. She'll take you to the
To the ward.
yeah, to the ward, to the blood test. सब कुछ कराओ. Sorry.
Sorry. That's done.
हो गया.
Thank you.
You want to say something?
No. Okay. See you in
Okay.
30 minutes.
Yeah. Reduction in the thickness not at the length or the height. So we're going to be working on the wet aspect of the lip mucosa, so the scars won't be visible. Immediately after we've done the lip reduction surgery, so you can see we've reduced the size but not too much, more in terms of the thickness. I'm going to show you the before right now. And when the patient smiled, she had an underlip that was visible like a double lip. So that's why the incisions have all been placed inside the lips. You can see there's some swelling more in the upper lip right now because of some bleeding. It's going to settle down. So you see, I put this so that because there's a little bit dissection, about a centimeter, we remove the muscles, so we don't want it to swell up more. But you have to be careful and have only liquid food, especially today and tomorrow. 24 hours, okay? That will rot. It will get. You can take a picture, yeah. You can take a picture now. Have preferably cold beverages, not as in alcohol, but otherwise. All right, so this is just day one. Few hours. I'm gonna take this off a little bit. So she's got a lot of swelling because we've done the reduction gently. You can have a look. So there are a lot of stitches inside. So that's how it looks when you do bilateral reduction. You can see the fine stitches, skin colored, and these are resorbable ones. They're doing well. She was a little apprehensive. She was thinking maybe the sutures are not doing well or something, but everything is good. We're going to see it again now, tomorrow, in a couple of days, and then we're going to show you through how she goes through the initial phases of healing before she goes back to her home country in maybe a week's time. Right. So I wanted to ask you one more thing.
Yeah.
The medications that we've given, you're taking them correctly?
Yes, sir.
Okay. And you have to preferably take liquid, lot of fluids, and cold.
That's what.
Don't chewing. No chewing.
I pressed my lip together yesterday, and then I felt like something.
Yeah.
And that's why I think.
But it's fine. It's fine because we have two layers there. There's one layer on top. If you look carefully in the mirror, you will see in some areas there are more stitches than the other in the area here. That's because the outer layer is gone. Okay. So there are two layers. One layer is there everywhere, and the area where you're telling me, the one area is gone because of your biting. But it's still good. It's still good. Okay. One is good. This is the second layer which we put just so that you have extra. Yes. Okay. So it's good. So you don't worry about anything. And I'll see you again maybe tomorrow, day after, whenever you want to come out. Okay. All right? Take care. Bye-bye.
Thank you.
Welcome.
Thank you.
Nice dress. Every time you come with a nice different dress.
Thank you.
So this is also from where now? And your lip is swelling, reducing today.
Yeah, I know.
It'll reduce much more.
Yeah.
And you're not upset now, right?
I'm just divulging. Will it come down or?
It's coming down. You can see it every day. It's looking much better already. It's going to come down much more.
Because this side is just like flatter and this side is like
a little bit bumpy. It should become all right. Trust me. It should be fine. Don't worry about that. All right. One other thing. Now, what we've had is in this last 5 days, this week. So you're originally from Ghana, you said, and you're in Germany, right? We had another lady who's originally from I think Eritrea, but lives in Norway. And then there's another guy who's from Ghana and lives in the UK. And then there's another lady, another baby who's from Ethiopia and lives in Ethiopia. And there's another lady who is from Windhoek, Namibia. All of these 5 patients in this week. So I've never had like so many patients from this large African continent in one go. So the other 3 are in the hospital yet. We're going to see all of them, maybe take a video.
Okay.
And you're the first in that 5.
I brought them.
You got all of them?
Yeah.
Really? Okay, right. So you're leaving tomorrow.
Yeah.
And you're also the first one to leave. The guy from UK, I think, is leaving on the Sunday. And the kid, did you see the kid?
Yeah, so.
How? How come? How did you see the kid?
I was here.
When you saw the kid?
Yeah.
Oh, that was a very cute kid.
Yeah.
And that kid is like, is that kid typically an Ethiopian or looks very fair and all, right?
I knew when I saw that.
Yeah, we've done the nose and the lip for the kid. It's come out well. We'll see that kid also today. All right. So we'll give you some medications. Doctor will run through your discharge prescriptions once more. You continue with the instructions that we've given us. Have a safe trip back and take our follow-up number and send your pictures on that number alone. So it's easier for us to get back to you. All right? Take care, Abigail.
So how does the scar look though?
It's not going to look at all. It's not going to be visible. It's just going to shrink and shrink and shrink more.
Does it look good?
Yeah, it is fine. It's totally fine. I can look from a distance that it's really improving. So what happened with you is because of that initial whatever that happened, so the healing is a little bit delayed on the lower lip. So you have to give it extra 3 or 4 more days than the upper lip for it to really shrink down and get on the right size. What's going to happen? Okay, you continue to take care because it still hasn't healed completely. You still have to be cautious about all the instructions that we've given you. Take the medications and everything.
I've taken everything.
Cool. Make sure she gets just check today because she leaves tomorrow. Antibiotic course, Desentia. If she needs some more, just give her a little bit more. Okay?
Also, the stitches, when are they going?
No need to remove anything. They'll stay for 2 weeks and they will go away on their own. No need to touch anything. Just make sure you don't injure your lips. All right?
Okay.
Done, Abigail. Okay, so I was telling you about the nose. So see what happens.
Wow.
Yeah, that's the thing that will happen. That's why I said the nose. It'll make a big difference.
Yeah, look, like all
Yeah,
this is going away.
all will go away. 100%. Even this will get tighter because you see I'm pulling it there.
Yeah.
See, the reason is because what happens, the nasal bone is little aplastic for you, so we can heighten it.
Yeah.
If you don't want me to do much here, we leave it.
No, I love this.
Yeah, so we let it remain. So we'll only increase the height. That will take care of these parts. It'll look really nice.
But you're so expensive.
Oh, they will do something for you. It's actually all together. See, this time,
Altogether, 8,500.
this time you don't have to stay in the hospital. Next time you will stay for 5 to 7 days. So it includes the stay, medicines, everything.
I'm gonna stay here then.
Yeah.
Oh.
I like those ladies.
It's
So-
good to have.
Yeah, we've done a lot of procedure for the other lady from Namibia. So that's why she's in a little bit, and she's 50. She's a little elderly. She's elderly.
Yeah.
So it takes longer to heal and there's a lot of swelling. And we did it last night.
Okay, so you say my lips are okay, right?
Yes, it will be fine. You take care, okay?
Okay.
Bye-bye.
Bye.
See you.